A YouGov poll found that half the healthcare workers they spoke to said working during the pandemic had taken a toll on their mental health, and the Liberal Democrats are calling on the government to improve the current levels of support.
COVID-19, for however long it's with us, it's not just going to be this sort of physical disease. It's going to have a huge aftermath. It's going to leave quite a lasting scar on a lot of people who have been sort of in and out of this process, particularly our health and care staff. So ensuring that they have that support package, I think, will be a really important issue in the coming months. And I really urge the government to engage with this, to support this, and to back it.
At the moment, NHS England offers a support line open from 7 a.m. to 11 p.m. and access to various mindfulness apps. But a new pack is suggested by the Lib Dems, including extending the opening times of the phone lines to 24 hours, and the introduction of things like mental health first aiders will help to fill the gap in support that they say currently exists.
There is a sort of tacit acceptance that there is a lack of support within the structure of our health and care system, and that the COVID issue is just going to exacerbate that problem. So making sure that we get ahead of the curve and ahead of the game on it, start setting these procedures in place as soon as possible now, ideally, so that when the aftermath starts coming in, the level of support is already there and we don't have people filtering through the cracks. So there has been a lot of consultation. I hope there's even wider consultation. I'm a care worker, and I've seen how her sort of mental health and well-being has deteriorated over this process. And I sort of put these suggestions to her, and there were really sort of elements within that she hadn't considered that she was almost allowed to have. But it's, I think, because for some reason we still have this sort of awkward conversation around people's mental health and well-being. So I think even if it just starts a conversation on how we best support those in the health and care sector going forward, then I think it's very much worth it.